much of the action as possible. We are live. Say good morning to your family and friends. Well, I was at another picket out around at Big Creek. So we are here this morning. Sorry that we are a little late, but of course, you know, we were covering the picket out at Big Creek. Good morning, everybody.
Morning, morning.
Quite a few of the community, the residents of this community, Willikes, Glanvilles, Seatons, Pierce Village, all of the people are out here standing up in protest and saying it's time for this clinic to be open. And so we're going to talk to a few of the community leaders to get an idea of why they are out here this morning. Morning, 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 everybody. Morning.
It's about time. We need our clinic.
Yes. Let me see what that is saying. Open the clinic. We want to enjoy our health benefits. Okay. So we're going to talk to a few of the community residents to find out what is the protest about this morning. Morning, morning. Protect me, officers. Protect me. I'm going live. I guess these officers don't have any difficulty protecting the cars. Yeah? Well, don't have any difficulty protecting me. Divert the traffic so that they don't knock me down. Oh, you want to knock me down? No. Eh? Oh, okay. All right, so please join the live, share the live with your family and friends. We are here in the Glanvilles community, and we are going to speak to a few of the persons who are here protesting this morning. They're asking the Ministry of Health and the government of Antigua and Barbuda to open this brand new polyclinic. Beautiful building. Brand new polyclinic, a gift from the government of China. And the government has not moved to open this clinic as yet. Morning, sir. Why are you out here this morning? Why are you out here protesting this morning?
Clinic to open.
Yeah?
For the clinic to open.
Uh-huh.
For the old people and young people get service.
That's important to you.
Yes.
Morning, morning.
Yes, imagine. Almost 50 years of in this constituency and not even one thing we can have for 50 years of reigning. Shame on your word.
Morning, and you see some of the young people are here as well supporting this action. And we're going to try to speak to one of the community leaders in this community who will be one of the organizers of this action. Morning, Alex Brown. Good morning, sir. How are you doing this morning?
I'm good. I just want to say thank you to everybody who came out this morning. You know, we're here outside of the Glanvilles PolyClinic, and we're saying that this clinic must be opened and open soon because it is over a year. It's going on 14 months since they had a groundbreaking, not a groundbreaking, they had this opening ceremony where it was handed over to the government. And up to today, it is still not open. The people are still suffering. They have to be taking 2 buses. One to Param Corner, and then into Param or something. People go straight to St. John's and then back to Param. So the elderly and young mothers are suffering. And even if it's just for a dressing for a wound, you have to go through all of this, and the clinic is there. It has been many, many years that we've been suffering in this area when it comes to healthcare. And finally, we have something that we ought to be proud of, but they don't think it is fit for us to enter it.
Can you give us an idea as to what the Ministry of Health and the parliamentary representative, what have they been saying? Why the delay in opening this clinic?
Well, first of all, the Minister of Health said it was lack of human resources. But I challenged it and I said, look, PL's clinic is not open. The clinic in Willikes is not open. Where are the staff who are in both clinics? Where are they now? I know they don't like nurses, they don't like anybody. But they were there before. There's 2 clinics that is down. And you're telling us that we can get people to open this clinic here? No, man, that is wrong on all levels. And if you don't care about your elderly and your youth, you should be out of office. Totally. Because it means you don't care about anybody, not even yourself. But I'm sure that they all have family. They have, some of them would have their grandmothers and their grandfathers, aunt, uncle, even the young children. That can benefit, but they don't care.
But Alex, I saw this clinic was opened for the administering of COVID vaccines in the height of the COVID pandemic. And so that particular excuse, if we want to use that excuse, that particular issue of human resources is not really.
It's rubbish.
Yeah.
It's basically rubbish. And I actually thought that this morning we would have seen Minister Yearwood here with us today. Because people here would have voted for him for 45 years.
Right.
And to show some compassion, as his Prime Minister would have said, show some compassion, come out here, be with the people, and have this place open. He has no compassion. It's all word, it's all talk. So we are saying, they've said to us, January 15th, after the minister would have backtracked and said he misspoke, after he said June, middle of June.
Yes.
So they said the middle of January, we are watching, we are waiting, because if we have to be here every day, after the middle of January, we will be.
Right.
Because we want to make sure that the people of this area are well looked after. And that's what I'm saying, we need this clinic opened, and open sooner rather than later.
Thank you
Oh
very
Lord,
much.
Jack, help the people them.
Thank you very much, Mr. Alex Brown.
Thank
He
you.
is the standard bearer for St. Philip's North, and he is standing up with his people to have the Glanvilles PolyClinic opened for the people of this community. It's been quite a while since the building has been completed, but yet we are seeing a long delay in terms of the opening of this facility. Morning, morning, sir. How are you doing? Morning, morning. Morning, sir. Any of you want to say a few words to our Facebook viewers about the opening of this clinic, the importance of opening this clinic in this community? Morning, morning, morning. How are you doing? Morning, morning.
I would just like to say, I hope the supposed representative at this moment listen. He has done nothing for the last 50 years, you can say.
Yes, sir.
Yes. This clinic is supposed to be serving the people of the Eastern District, especially the elders. And it is really a shame that they have to be traveling from Willicays, from Glanvilles, from Seatons to Newfield and to Parham, and having to be paying bus fares in the order of $15, $20 at a time when it is so difficult for them to get their pension payments and so on. So it's putting an extra burden on the elders. And if they open the clinic, it would be a great relief. This clinic was completed over a year ago.
Yes.
And it is just standing there like a white elephant. We can't have this, man. We've got to have this clinic opened like yesterday.
Right.
You know what I mean?
Now, I heard the Minister of Health say that January 5th, the middle of January, this clinic will be open. Are you, the community people, are you willing to wait until January 15th to have this clinic open?
January 15th?
Well, it's the middle of January. Well, he first said June, and then he said he misspoke, and he clarified and said not June, but January.
I told you that this thing should have been opened
Yesterday.
yesterday. So that answers that question. But even then, I am not assured that this will be opened by the middle of January. No.
And I think January sounds like it coincides with maybe election in March. So they want to have all these things happen before the election.
Yes, they're promising and promising and promising. We have the water situation, the total last year, 2020, sometime in February, that this water problem would have been solved by November.
That's right.
Where we at now? We're in 2021, December, and now they're promising us when in June next year. So it's just a long litany of promises and so that are never kept. So I don't know. I cannot be assured that these promises will ever materialize.
Thank you very much, sir. You wanted to say a few words, sir?
I think the fact that the clinic is not yet open is very abusive to the constituents of the St. Philip North constituency. And as Dexter just said, that the elderly has to pay so much in fares to go to the prime clinic and so on. And in a time like this, when we have the pandemic issues and so on, where many people are not working, it's a hardship on people. And I think this is where this would come in to actually help to ease some of that financial strain on people's pockets.
Thank you very much.
You're welcome.
Have a good day, gentlemen.
Yes,
Thank you. So we are getting the sights and sounds of the action here at the Glanvilles Clinic, and we are trying to get as much of the community, people from the community, talking about the importance. Morning, ladies. Morning, gentlemen. The importance of opening up this clinic. You're from this community, sir?
Yeah, Seatons, yes.
Seatons, yes. And you want to see this clinic open?
Yes, come on, me ever pay all the money go for pay how much bus money go for.
Right.
But this how we not like a turn the shelter for the next hurricane season. That's the one that's not going to hurricane shelter.
Oh, I see.
That's all me get there.
Okay. What about you, sir? You're from this community as well? Yes. And what are your views about the opening of this clinic?
Well, I would like to see it open, but open don't have too much money to pay when they have to go to family to power.
Pull up your mask, please.
They have too much money to pay family to power. They have to pay $3 from here to town. They pay from town to power, pay from power back to town, and then pay from town come back home. That is all over $12 what they have to do. And this space here was sitting down.
For the last year?
Yeah. How much years since they finished? Because the EHX took my vaccine and you were open.
Right.
So how the vaccine finished now? Why did they open it? So I would like to see it open. They had on the mountain down there. So I would like to see it open.
Thank you very much, sir. Morning, morning, morning. Morning, how you all doing? Okay, have a good day. Okay, and so we are at the site. I'm going to actually go
One question
into...
I'd like to ask you, right? Do they have the cadre of nurses and doctors and so on?
Well, you're speaking to the Minister of Health. You can ask him. We're live. We're live, so you can ask. You can actually ask that question.
My friend Malwin. Mr. Joseph, how are you? Yes, yes. Do you have the cadre of professional in the health service to be satisfying the hospital for the needs and so on? The nurses, the doctors and so on who are required? Because I understand that there's been an exodus of health service
Indeed.
personnel from
Yes.
from the nation. So what is the situation as far as that is concerned?
Okay, that's a question for the Minister of Health, Sir Malwin Joseph. Do you have the human resources to open this clinic as well as to run the Sir Lester Bird Medical Center and all of the clinics around St. John's and across Antigua and Barbuda? Just before we wrap up, what I'm going to do, ladies, you have anything you want to say? You're live.
And thank you for coming and opening the clinic because we need it.
Yes.
But they have to go to Newfield and they can't go to the baby's clinic because the people have no transit to take them.
Okay. Thank you very much, ladies.
Okay, you're welcome. Okay, my love.
Okay, thank you. So what we